The disc replacement is to, whenever we need to stabilize the spine, but we also want to preserve the motion of the spine that is essential, we use a disc replacement, which is a prosthesis that are going to substitute our disc. So whenever we have a pathology that affects the disc herniation, and we have a young patient that we want to preserve the motion, we can use sometimes, but in specific case, disc replacement that is going to allow us to do the decompression of the nerve roots, but also preserve the mobility of the spine. Essentially use the disc replacement in the cervical spine. We can also use in the lumbar spine, but is in more specific cases. The best candidates for disc replacements are young patients that don't have much degenerative disease of the spine and only one or two levels where the nerve roots are compressed by a disc herniation, acute disc herniation, and we want to preserve the mobility of the spine. The main benefits of disc replacement is that we are going to preserve the mobility of the spine, of the segment of the spine that we operate on, and the main advantages are that the patient can return to normal life in a faster way, and also we try to prevent what is called the adjacent level disease, which is disc disturbance or disc herniation on the level above or below where the patient is operated on. So the main advantage of this procedure is the preservation of the mobility of the spine and try to prevent the disease on the levels above or below where the patient is operated on. The recovery process is more or less the same as when we do a spinal fusion, even though the patient are allowed to do movements sooner than spinal fusion, because the goal here is to preserve the motion. So basically the patients can return to their normal life in a faster and easier way.